quite varied in her topics that she talks about. She talks about I've heard talk about the cerebellum now, and then also she talks about Morgellons disease, which is quite a rare condition, but like when you have it, like dear God, you really want to make sure you have a clinician who knows about it because it's a really debilitating, challenging condition. And so, anyways, Dr. Cornish was talking about how the cerebellum is actually involved in so much more than just balance. It's involved in a lot of different, like emotional processing. It's involved in different, higher level nervous system function. Like so, of course, every region of the brain is important, and there's interplay between, all the different regions. To a large extent, the cerebellum is just more than just for balance. Anti-Purkinje cells, which is also related to cerebellar function, anti-Yo antibodies, which, if memory serves, are also related to cerebellar function. Then the anti-amyloid beta markers that relates to beta amyloid plaques, which can form, which are kind of a hallmark of Alzheimer's disease. So if we see those antibody levels coming up, then that's where we start to get a bit concerned that like maybe there's this neurodegenerative, well, this some uh, pathophysiology that would potentially lead to dementia on the horizon. So the third report that I'm going to go over goes into um, uh, uh, well, we'll see those come up in the third report that I'm going to talk about. And so anti-RAGE peptide, thinking like, oh my gosh, like anti-Inger peptide, like what a funny acronym. But it's RAGE is an acronym, I believe, for receptors of advanced glycation end products. So that has to do more with like blood sugar dysregulation. If there's these glycation end products, it's where like basically elevated blood sugar levels lead to accumulation of these AGEs, advanced glycation end products, which are highly deleterious to the health and integrity of the central nervous system and can predispose to amyloid plaque formation and neuroinflammation. Anti-tau protein, so the tau is also part of those. Part of the pathophysiology of Alzheimer's, and then different neurotransmitter antibodies. So glutamate, which is a neurotransmitter in the nervous system, dopamine, of course, being a neurotransmitter. Other elements here of related to like neurodegenerative propagation. So as we see here with this patient, overall, he's looking pretty good. I mean, there were some balance issues, which, with Parkinson's, that kind of goes with the territory in a lot of cases. But 15.6, it's, something to pay attention to, but nothing terrible with that anti-cerebellum protein, or antibodies rather. The anti-tau, it's like, okay, something where we're already getting on top of his brain health like white on rice. So we're going to hopefully see that anti-tau coming down because that is involved in the development of Alzheimer's potentially and down the road, and then the anti-RAGE peptide just being quite low. So generally speaking, he's doing a good job with his diet. He's again older gentleman, so blood sugar regulation gets a little bit harder as we get older, unless we're really being on top of things. But we're tweaking his diet a bit as well. It's work in progress, so nothing too crazy coming up on the brain autoimmunity section for him. Brain inflammation really doesn't look too bad with the anti-NDMA receptor, anti-AMPA receptor, anti-GABA receptors. So looking, pretty decent, all things considered. Again, it was already doing better before we did this test, so hard to say what it looked like at baseline, but looks pretty good. And then just moving on, oopsie-daisy. Moving on through with the more brain inflammation indicators. So yeah, some of these markers looking really good, but then seeing these anti-Casper antibodies, which is associated with neurodegeneration being quite high. And then really what, stands out like a sore thumb or sticks out like a sore thumb is these anti-dopamine receptor 1 antibodies, which are, as high as they can get, or like it's the highest reading you can get from this type of test, and then the anti-dopamine receptor 2 antibodies, also elevated to some extent. So those are numbers that we obviously are really interested in targeting. Now, it is good to see that the IgM antibody levels for both of those look really good. So those are nice and low within the control range. So suggesting that like yes, this fire was set, but there does not seem to be evidence of like ongoing additional fire setting. So that's really great to see. But yeah, we really want to track those numbers. That's really probably the most important thing to get on top of. The very last section here is looking at infection. So this is where it gets quite nuanced, and this is where it's also really good to look at the full report findings, not just what comes up on the summary, because here we can see, like, okay, the cytomegalovirus GLI-B came back positive for IgG, but everything else for cytomegalovirus looks good. Or with Epstein-Barr virus here, we can see that the EBNA, the Epstein-Barr nucleic antigen, came back as a very mild positive. The viral capsid antigen came back as, a pretty notable positive, and then everything else looks good. So when we see results like this, it basically tells us that, to my understanding, at least, and again, not medical advice, but it tells me that this patient has been exposed to the Epstein-Barr virus, but does not seem to have Epstein-Barr virus reactivation or chronic EBV, which is really great. So this tells he's been exposed, but it does not seem to be an ongoing issue. Same thing with the cytomegalovirus. We see his HSV1, so herpes simplex virus 1, which causes oral cold sores. HSV2 usually causes genital cold sores. There can be overlap between those, but that's the case. Looks like he's never been exposed to the herpes virus, which is good and kind of rare because over time, a lot of folks have been exposed at least to the HSV1 virus type. Just sometimes it just stays in dormancy for their whole lives and they never know it. But anyways, he's never had exposure by the looks of it. HHV6, HHV7, all looking good. And then streptococcus came up through the roof high. The relevance of the streptococcus being elevated for him, hard to say. There are some really interesting animal studies that have been done showing that the more strep an animal gets, the greater the risk of autoimmunity for their brains. And that's why, the condition PANDAS, pediatric autoimmune neuropsychiatric disorder associated with streptococcus, i.e. streptococcus triggers this autoimmune neuropsychiatric disorder in kids. So that's why strep can cause that, really what can be a very severe, debilitating condition for kids. We don't really know definitively what the relevance of that is in adults. So I kind of look at this as saying, like, well, you've had strep, you have high levels of antibodies against it, and it might be something that is contributing to the pathophysiology, maybe, but it doesn't really necessarily change our game plan necessarily. In some patients, we will really take that to heart and work with low-dose immunotherapy for strep. We'll use nasal sprays and throat sprays to try to bring down strep titers if we think that's relevant. So it can be relevant in some cases. In other cases, it might just be more of an incidental finding saying that, maybe the strep led to a lower threshold to develop an autoimmune condition affecting the brain, but it's not necessarily something that's causing an active issue right now. And just where we're seeing those IgM antibodies being low, it's wouldn't be the front and center thing that we necessarily need to work on, but depending on the protocol, we'll sometimes throw some strep immunomodulation support that's more specific, but the overall immunomodulators can do the trick too, depending on the case. So those are all the markers. So it's a lot of markers. And so in my opinion, the NeuroZoomer Plus gives us a lot of really useful information. It's a very comprehensive test and I really love it. My one complaint about it, it's sort of a diluted complaint, but my one complaint about it is that it is a fairly expensive test, especially for us Canadians up here where our, it's a US lab, so it's in US dollars, and our Canadian dollar has been weak for many, many years now, unfortunately. And so it's a $420 US, at least as of the time of this recording, which is, recording this on August 14th. I don't know exactly when I'll post the video, but anyways, August 2025, $420 US. It's tax exempt for us here in Canada anyways. That includes the shipping cost. Again, with our patients, they pay the lab directly. We're not financially involved with the lab. So as I'm fond of saying, don't shoot the messenger. It's not my fault. It's so expensive. So I say it's kind of a diluted complaint because yes, it's a big chunk of change, no argument on that. However, when we look at what one is getting for the value for money on this, there are other labs that test some components of the NeuroZoomer Plus. And a lot of those labs are much more expensive if they were to be done individually. So for example, if one was to do a Cunningham panel, my understanding is, nowadays that's around $1,000 US to do that. If we were going to do a panel, like a viral panel for, HHV6, HHV7, Epstein-Barr, cytomegalovirus, through the standard labs that we use when we're just testing for viruses, that's easily going to be $400 or $500, Canadian anyways, because we use a lab in Germany, which is a great lab called Erman Labs. it's when we convert into euros. So yeah, I guess it would be around $300 US or something like that. So it's when we kind of piece this all together, and that's just looking at, certain markers. That's not looking at all 47. So if we were to test for all of these different components individually, many of these tests, I don't know where else you would get them done, to be perfectly frank. The $420 price tag, like it is, in my opinion, for what you're getting, it is very reasonably priced, but it is still really expensive. So just to put it into context, I don't want to throw the lab under the bus saying like, oh my gosh, they're padding their pockets. I mean, of course they are, because they're a lab, and it's a capitalist society world that we live in. But I don't think that they're gouging people on the price is what I'm ultimately driving at. So that's what you're looking at cost wise for the NeuroZoomer Plus, and that's what a report looks like. As I was going through the report, I realized that I underestimated the amount of time it would take me to go through this report. I genuinely thought I'd be able to get through two other reports, but um, I have a patient coming in soon, and I don't have time to go over the other reports. So I'm going to officially call this a part one, and I will go through the other two reports in part two of this podcast episode. So I hope that this was of interest. If there are questions or comments about this, please feel free to post in the comment section below. If you're watching this on YouTube, if you're listening to this on a podcast platform and you have questions or comments, then feel free to email my front desk. Feel free to find this on YouTube and just post the comments on there. I do look at all the comments and questions, and I will happily get to them when I'm able to. And yeah, I thank you for your attention, and I will leave it there for now.